tag on at the very top. You'll see slides. That's where we'll be sharing the slides at the top.
We have a raised hand. Please go
Oh,
ahead. As a reminder, any AI note takers are not permitted in this webinar. So if you do have one, please remove them. Thank
or
you.
yeah, where it will be removed.
Mm.
All right, we're going to get started here today as people keep coming in. So today, as part of the Connected Communities Health Initiative, we're doing Understanding and Addressing the Childhood Chronic Disease Crisis. Integrated Behavioral Health in a Digital Age is a really critical topic for so many youth and families. Next slide. And just some housekeeping. All participants will be muted on entry. That way we can limit the background noise. Please try to use the QA or the chat box to ask questions during the session, and we'll keep up with them and make sure that any questions get answered at the end if they don't get answered throughout the course of the discussion. We are recording today, and all of our materials will be emailed to our participants. And we'd love to hear your feedback. This helps us improve what we do. So please fill out the brief evaluation at the end of the session. Next slide. So the Connected Communities Health Initiative is a group of national training and technical assistance partners. We work with health centers to improve their health and the well-being of their patients and communities. We provide a lot of different kinds of tools and resources and different learning opportunities that empower providers to tackle the root causes of health challenges and deliver lasting positive change over time. Next slide. So the purpose of this series today is to increase awareness of childhood chronic disease trends that may be impacting your health center patients and their families. We want to identify the key drivers highlighted in reports and studies, and we want to connect report findings to community health management, quality improvement, and integrated care initiatives. Next slide. So today, HOP and MCN are hosting this webinar. Health Outreach Partners, or HOP, is a nonprofit organization that supports health outreach programs by providing training, resources, consultation, workshops, and webinars. We respond to community needs by equipping health partners with relevant strategic knowledge and tools to transform communities from the ground up. This helps result in a healthy society and improve access to care. We serve community health centers, primary care associations, and safety net health organizations. And when you get this slide deck, you'll be able to click these links to find out more about HOP. Next slide. And Migrant Clinicians Network is also a national nonprofit that's organized. The organization is focused on clinicians, health centers, and community organizations to strengthen clinical care, healthcare infrastructure, and outreach for migratory and seasonal agricultural workers and their families. Migrant Clinician Network, it has 40 years of experience providing extensive training and technical assistance to foster knowledge, creative solutions, and improve care. And again, links will be available when you get the slide deck. Next slide. All right, so our learning objectives for this webinar today are to describe the impact of problematic media use on pediatric behavioral health, identify and use early screening and intervention tools, and review prevention and intervention approaches to reduce digital dependence in youth. Next slide. We have a special guest speaker today, Dr. Lanre Falusi. She is a primary care pediatrician and educator based in Washington, D.C. She serves as a spokesperson for the American Academy of Pediatrics, an ambassador for the Center of Excellence on Social Media in Youth Mental Health, and is a committee member of the Federal Government Affairs. She has held numerous local and national leadership positions for the AAP. She has spoken at conferences, in congressional testimony, and in the media on topics including youth mental health, poverty, faculty development, and more. Dr. Falusi attended medical school at the University of Virginia and completed residency and chief residency at Children's National Hospital. Welcome, Dr. Falusi. I will hand it over to you.
Thank you so much for that introduction, and thank you all for inviting me today. This is really an honor, honestly, because my career started at a community health center. The first 7 years of my career after residency was in a setting probably very similar to where many of you are working. And then in the academic world, excuse me. I should warn you all, I have three children, and at least one of them has given me some type of winter virus. So if my voice goes in and out, that's why. But yeah, the start of my career in academia began with a HRSA grant. So really appreciative of all of the work that you do, and to MCN and HOP for the invitation. So we can go to the next slide, please. All right, so today I'll be talking about problematic media use, particularly screening and intervention. There's so much we could talk about when it comes to youth mental health in the digital age. We could talk for many days, right? So it's a fairly focused talk. Having said that, at the very end, there will be several slides with resources with additional information like background data or additional websites where you can learn more if you have questions that aren't answered today. But we will leave some time at the end for Q&A. Next slide, please. So a couple of disclaimer slides here. I'll just leave them up for you all to read. All right, great. So what is it that we're talking about when we say problematic social media use or problematic internet use? You can turn on the TV or open up any social media app, and you're bound to see something around kids being addicted to technology, addicted to their phones and social media. Messages like this, can sound alarmist, whether you're a parent, a clinician, a teenager yourself. And unfortunately, that type of language is not necessarily grounded in strong evidence. So the purpose of this first slide is really to kind of move us away from the addiction language framing, as that can be stigmatizing, thinking of the child as the faulty party when it comes to technology use. And it doesn't acknowledge the fact that there's a whole ecosystem around that child that maybe explains why they're so drawn to certain technologies as opposed to some in-person experiences. And there are elements inherent to some digital tech that is pulled to grab onto and keep their attention. Next slide, please. So problematic social media use or problematic internet use, you'll hear me use both words or both terms, is not the same as substance abuse or addiction. Also not a direct representation of the number of hours of use. If any of you trained some time ago, like I did, we were always taught to ask, or to advise parents, no more than 2 hours a day of screen time, right? That was sort of like the dogma because we felt that more than 2 hours a day was detrimental, less than 2 hours a day was okay, right? So we moved away from that kind of, black and white kind of sort of guidance, as all of this framing really doesn't help us to identify where we can intervene early. Maybe it's helpful in the most extremes of problematic use, but as clinicians, we want to try to detect some of these issues earlier on so we can help families earlier. Next slide. So on any given day, hour, minute, a teen may grab their phone or other device and use social media for a number of things, maybe to distract or to procrastinate or space out a bit. Not all negative, maybe to connect to other folks, right? This is all developmentally normal. So we're not talking about sort of typical use or even silly use where they might send emojis to each other, that sort of thing. And also thinking about some of the settings where you all work, if youth are really geographically isolated, social media can help them connect to others, right? So it may be a way to combat the loneliness epidemic that you hear about. But what we're going to focus on today is really more persistent, problematic use of technology. So to understand where we are now, we have to kind of go back and understand how we got here. In the next slide, please. So this is what we used to think about when it came to the idea of problematic internet use, right? You see this dad trying to drag his kid to the car while the kid's still kind of chained to his computer. So we started talking about this in the 90s with using what we knew of at the time as the existing frameworks of substance abuse or dependency or pathological gambling. Next slide. This has evolved over time with some studies to um, do a better job of including adolescents and young adults and psychologists, media studies experts to think about what is actually happening with the development and mental health of youth. And the bottom line is when we think about problematic internet use, we're thinking about use that is risky, excessive, or impulsive, and that specifically has some negative consequences, which can be somewhere on that spectrum of physical, emotional, social, or functional impairments. So, really thinking about how a youth relates to technology, not a specific number of hours or a type of technology, but how they're related to that technology and what the outcomes or consequences could be from that. Next slide. So this is kind of where we are now, where we've, again, kind of moved away from like specific disorders that are named or utilizing addiction technology to the next slide. Getting now to this idea, if you go to the next slide, please. To this idea now of problematic internet use, or PIU, is the term that you'll see most often in the literature. So this is defined again as internet use that is risky, excessive, or impulsive in terms of the youth's relationship to that technology, and leads to adverse life consequences. So we know that, compulsive or quote unquote addictive use may be an extreme end of problematic use. And I think that is what often gets headlines. There are so many aspects to this that are not focused on addiction. And I'm probably overemphasizing this because I know that as a clinician, if you start thinking about like youth being addicted to something and there's a whole system, it feels very disempowering in that language. So whereas when we recognize that there are many steps leading up to that and other places where we can intervene, we recognize that we in our 15, 20-minute visits can actually address some of this and be of help to families. So next slide, please. All right, so before we can address a problem, we have to first identify it, right? So on the next slide, when we think about the impacts of social media technology that is, again, risky or excessive, the mental health impacts can be real. So what is it that parents might see? They might see changes in behavior, physically, maybe changes in eating habits and sleeping habits, changes in emotionally, socially, functionally. A youth may avoid offline or IRL in real life connections and choose to be online with folks instead. May see a drop in their grades or that they're becoming emotionally withdrawn, or using technology and digital media as a calming mechanism, right? So, and I don't necessarily mean using like a calming app with music, but rather, scrolling through a social media app as a way to kind of calm or avoid emotions. Next slide. And what might happen in school? Schools or teachers may report to parents that the children are falling asleep in class. Oh, sorry, I'm seeing the questions around getting slides. Yes, you will definitely get the slides afterwards. So thank you for asking that question. Or a child may be sneaking in a device during class. So schools, such as the schools in our area here, many of them have developed away all day policies, so no phones during the school day. But with problematic use, if a youth feels like they cannot be separated from their device, schools may say that they're sneaking them in, or as I mentioned before, lower grades due to overuse of technology and a lack of social connections. And some of the slides toward the end will point you towards some studies around specific connections between types of digital media use, either types or amount of, or the relationship that the youth may have with technology with specific mental health concerns such as anxiety, depression, eating disorders, that sort of thing. So anyone who's looking for that specific data will get that in the slides. So next slide, please. So then what can we do to be able to identify? So if a family is bringing in those concerns, as mentioned in the last couple of slides, then that may be the conversation starter. If maybe you're asking specifically around those, that's a great conversation starter. But one thing that we know when it comes to screening for developmental concerns, for mental health concerns, is that universal screening is really often our, best way to identify these issues. Parents and even us as clinicians may not jump to ask these questions directly or bring these issues up, but when we have universal screening, then we're able to identify some of these issues early on. These are all clickable links. So when you get the slides, you'll be able to click on these and see. For adolescents, that's a typo, I apologize, ages 12 and older. There are a couple of screening tools. And then for those 11 and younger, there's a screening tool. So the first two links here are to be completed by the adolescent themselves, the Problematic and Risky Internet Use Screening Scale, or PRIUS. It's a 3-question quick screener. Again, completed by the adolescent. And kind of, if you're used to the PHQ-2 and PHQ-9 for depression screening, it's a similar concept in that if you have a positive screen from the PRIUS 3, then you can provide the full PRIUS 18, which has 18 questions. So the PRIUS 3 has 3 questions. How often do you, 1, experience increased social anxiety due to your internet use? 2, feel withdrawn when away from the internet? Or 3, lose motivation to do other things that need to be done because of the internet. So again, not how many hours a day are you on the internet, but really what are the outcomes? Are you having social anxiety when you're not on there? Do you feel withdrawn when you're away from the internet? Or are you losing motivation to do other things? And there's a scale from 0 to 4 for each of those questions. So a positive score is considered 3 or higher. So they could say rarely to each of those 3 questions, and that's a positive screen. And with that you could follow that up with a PRIUS 18, or you can jump right into kind of the discussion around intervention and management. For our younger kids, the problematic media use assessment is completed by parents. It has similar questions as the PRIUS in terms of how maybe internet use is affecting things like sleeping and eating and spending time with other kids. And again, as I said, it's completed by the parents rather than by the youth. So next slide, please. And I'll come back to those screening tools again later. So let's not forget that, a screening tool, even like the PRIUS, which is validated, does not replace other screening tools because problematic internet use may occur with mental health concerns. So continue to screen for depression and anxiety if you're doing that within your health centers, and other, of course, emotional health and developmental screening tools can be used along with the PIU. Or a little bit the PRIUS rather. Next slide. So again, you'll get these slides. So the PRIUS 3, and when you try it out, see how long it takes you. When I've looked at it, even with some kind of like thinking back to the last like few weeks, I feel like I could complete it in less than a minute. You can try it out with a few adolescents in your office and see how long it takes them and get some feedback from the patients, from the clinicians in your office as to how feasible, and then kind of going a little further, how helpful is it in guiding those discussions? For those who have the ability to do QI projects or kind of small scale trials and testing of these kinds of screeners, this is a great one to be able to incorporate again because it is short. At least the PRIUS 3 is short. Next slide, please. So as with any screening tool, it's not just about getting the data. The next question is, so what? So what do we do with that information? So here's one example of a published study. So the PRIUS has been used in school-based clinic settings where a nurse in the school-based health center reviews the PRIUS findings that the youth completed, and then together they determine an intervention plan. So I love this because with training, any type of clinician could be the person who kind of jumps in and works with a family to create an intervention plan. And these plans could really be driven by what the PRIUS findings are. If the youth checked off that often they're choosing to socialize online instead of in person, maybe the plan includes meeting up with some of your online friends at a coffee shop. Of course, friends that are already known to you, but kind of stepping out of that online space to the in-person space and kind of learning or relearning how, 3D facial expressions or body language or kind of conversing in a group in person is different from doing that online and gaining those really important communication skills. Or if the screener showed that the youth is losing sleep due to nighttime internet use, maybe they're then creating a plan that's focused on sleep to really, maybe you're charging your phone outside of the bedroom or at a certain time of the evening, all of the phones go in one place in the home and the youth does not have access to it after that time. Or if the concern that comes up with the Prius findings is they're irritated or agitated when they can't access their phone. Maybe the plan is more around working on mindfulness and breathing exercises and ways to kind of calm ourselves down that don't require picking up a phone and kind of getting pulled into other people's reels and stories and all of that. Next slide, please. So how might you think about incorporating a screening tool? And the well child visits, you could consider adding the Prius 3 to your screening forms. And then if there's a positive screen, then they either flip to the next page, or if it's electronic, then up pops the full Prius 18. If you wanted more data, you could act again just upon the Prius 3. For those who use Chattis, which is an online repository kind of portal that many practices use for pre-visit questionnaires. The Chattis includes the Prius, so you could add that to your list of screening tools if families complete. And then again, you can use the full 18 questionnaire if the parent or the patient raises concerns about technology use. So I always have to put the disclaimer again, as a primary care pediatrician, we have our families fill out a lot of forms, and I'm sure you all feel the same way. So just being judicious in what we're asking families to do, I think is really relevant here. And having said that, I think this day and age, at least verbally, if not doing so with a formalized paper or online screening tool, is really critical with the data, increasing data that we have around the impact of internet use on youth mental health, both positively and, of course, the potential detrimental use with problematic use. If you're seeing a child for a more problem-focused visit, excuse me, um, there's another framework that you can use, and certainly you can include the PRIA screening form in a problem-focused visit. But if you find it more helpful to kind of weave it into the conversation, there is, and you'll see this in a couple of slides, a framework called the 5 Cs that was developed by the AAP Center on Social Media and Youth Mental Health. Five ways to kind of think about a youth's internet or media use. So the first C is child. So if is a child struggling with their relationship with media, every child is different. So some may struggle, some may not, some may have different proclivities as to how drawn they are to media. What is the content? So not all content is the same. That's why, again, we've moved away from the no more than 2 hours a day of screen time, because some content may be educational and helpful, and others may be risky or disturbing. The third C is calm. So is a child struggling to find calm without the technology? Is that the way that they are sort of figuring out to calm themselves, which may actually just be zoning out, right? And scrolling or watching passively, and that is what is being considered as calming down. So is that something we need to think about? I'll say my favorite C is crowding out. And that's a question of, is media use crowding out the other really important things in a child's life, like sleep and physical activity and schoolwork, and then super importantly, socializing offline. I say that's my favorite because I think sometimes that's the easiest or lowest hanging fruit for families to notice. Maybe the question in that or the issue for this problem focused visit is I'm worried that, my child is not focused in school, right? And maybe in like unraveling that or peeling the layers of that onion, you're finding that they're, not getting enough sleep overnight, or in some media use may be part of that. And that's something that you can address pretty directly. The fifth C is communication, which we'll talk about more in a bit, but these are ways to kind of maybe consider weaving in some of those questions into a problem-focused visit. Next slide, please. All right, so we keep moving upstream. We've talked about how to identify problematic internet use. How can we even think about preventing problematic use? If you go to the next slide, please. So here are the 5 C's again. So preventing problematic use in so many ways starts with communication within the family. So we all know that there are like very large companies that create these apps and these platforms. And the goal is to, right, grab onto and keep your attention. But starting within the communication of the family is a great way for teens and youth to start to like conceptualize what the point of media use is and where they can gradually learn to be more independent and take more ownership over how they're using media. So we talked about those first 4 C's already. And that fifth one of communication is really the key to all of the others. So this can look like encouraging families to keep having that open dialogue, about this. And even, I mean, you can make it sort of lighthearted, looking at the youth, the teenager, and saying, I'm sure you feel like your parent knows nothing about the internet or about social media. You may feel like I don't even, I'm probably too old to know as much as you do. So we're really kind of depending on you to help like teach us so that we can also then help to keep you safe, right? This is a partnership. It's not a dictatorship of like the parent and the doctor together coming up with a rule that the child must follow, but rather all together as a partnership. We think about where we may want to set some healthy limits, where we may say that, oh, there's some, good aspects of this media use, and come up with reasonable, feasible plans together. Next slide, please. So how does this look practically? Again, like that's as a clinician, I hope that this is what you kind of walk away with, how you can actually not just know the theoretical frameworks, but really put this into action. We have a few thoughts here. One, the AAP has this family media plan that you or a family can pull up online. And there are various levels. It's sort of a choose your own adventure is how I would say it, where a family could easily spend a couple of hours together, kind of going through this online plan, creating it together. At the end, you get this kind of like beautiful graphic of what your plan is. You can print it out. Or they can kind of just kind of scroll through it and pick out a couple of things that the family wants to do together. So it doesn't have to be this long drawn out process. It also doesn't have to be one thing that is done in one sitting, right? The internet is constantly evolving. Our kids' brains are constantly evolving. So I think it's reasonable to say that every like few months or something, the family kind of checks in with each other on where they are with their family media plan. So what does the plan include? May include things like a screen-free zone. So we don't pull out our devices in certain parts of the home. So the dining table or the family room, maybe there are device curfews. So at a certain point in the night, all of us put our devices away, or screen-free times. So meal times, for example, are a great time to say we don't use our screens during meal times. And in recognizing, of course, not all families have, meal time all together with everyone there, but whatever that may look like, there may be some times where they decide that there are no screens. And then usage agreements. So we agree that we're putting parental controls on certain apps, and those are and talking about why those are there. Um, I'm going to repeat this part over and over that it's really key for parents to role model these expectations. And that again, this is not about the youth being punished, but rather that we together, all as a family, are setting these expectations for one another. So the second bullet point there around the parental control settings. So definitely using those where they exist on devices and platforms. I will say that I've been on a panel where there was a youth member, there's a youth advisory council for this AAP Center of Excellence. And I and a couple of others were on that panel, and the youth said, yes, absolutely, like put those parental control settings on, but also know that teenagers know how to get around them. So that's the reality, right? So it's, so with that, it's okay to lean in on to your child's tech expertise, of, how do I set this up? Where do you see that there are loopholes on here? So ways that you can kind of focus on the parenting and say, okay, so sounds like you can use, facial recognition on this app, and their AI system can maybe guess that you're older than you actually are, right? These things aren't perfect. So then this is where the parenting comes in. So if that happens, what will you do? If it all of a sudden thinks that you look like you're 18 and it takes off the controls, which some of these apps will do, what will you do in that time? Kind of talking through how they might approach that. And, hopefully the answer is, well, I'll let you know, parent, so we can kind of figure out what we need to do from there. And then talking about digital media on a regular basis, again, that fifth C of communication. And on the website, there's some great conversation starters that you can use to frame these discussions. I love when I'm in the car with a child and they are a captive audience, and I can ask all of the questions about school and friends and all of that. So whether it's a car, sitting next to each other on a bus, or whatever it might be, walking, those are great times to encourage your families, the parents that you're seeing, to talk to their kids about these issues. And the conversation starters on the website are, things like, what kinds of the basic questions, like what apps are you using these days, to more specific things. If safety is a parent's main concern, there's some conversation starters around that. Like, has anyone ever tried to chat with you or reach out to you that you didn't know? And what happened there? The big key to the conversation starter, to the communication with kids, this is not, rocket science, is for the parent to really have an open, curious, non-judgmental posture. I know this is easier said than done, but what we can coach our patients, our parents, to do is to ask those questions and then kind of wait for a response, and to ask them in a way that invites a response from the teen that is honest, and not one where they feel like now they have to kind of cover things up. Again, easier said than done, because I think that sometimes their parents avoid these conversations because they're worried about the answer, but it may not be as bad as they think if they're able to, again, kind of maintain an open posture. Next slide. So how do we manage this? So as clinicians, we can counsel our parents to talk to their teen or tween about their motivations for media use. So maybe you don't jump right into the, what are all the terrible things that you're seeing online these days, right? Or, why do you use your phone so much? But rather, what do you get out of like your media use? So if that sounds familiar, it makes me think about the trainings that we've all, or, hopefully many of us have had around like motivational interviewing. So tell me about what is good about this thing that you're doing, which may be, tobacco use, for example. I feel like that's the common thing that we're often trained for motivational interviewing. You're trying to help your patient quit smoking. So, but first recognizing they're getting something good out of it, right? So asking the teen or tween, tell me what you're getting out of like being on social media. What are the good things that you noticed? And recognizing that's real for kids, right? And also recognizing that there are some challenges. So what might be contributing to problematic media use? So are they seeing any issues with that? How are they feeling like they're sleeping and having time with, with friends in real life? Is there anything that they're seeing that may be problematic? They can talk about the design of the media that they use. Is it more interactive? Is it really passive, kind of scrolling and watching short videos? Are they chatting with friends? And developing a plan together sometimes means that the teen may not agree with all of it. And, that's okay. One way to encourage parents to approach that is to say, like, let's just try this for this week, right? Because we really do need the teen's involvement in creating a management plan that's going to last. It's not going to be sustainable if the teenager is not about it at all. Even if you can execute it by physically taking the phone away at 9 p.m. every night or whatever you decide, it's not sustainable because at some point, parent will be tired of fighting and the child will figure out a way around that. So ideally, we do want everyone on the same page. But when there's an impasse, then maybe the language around like, okay, we're not all on the same page. But we know that if we stop, using our phones at this particular time, we'll probably will get better sleep. Let's just try it for this week, and then we'll check in next weekend. Right. And setting that check-in time makes things feel like it's not, a forever rule necessarily, but rather that teen will still continue to have input. And then again, talking as a family about these media use limits means having clear and explicit rules, and following the rules consistently means everybody, including the parents also. Granted, there may be, work reasons why a parent may be on a device later on in the evening, and those things just have to be communicated. One of the tips that's on the website is for parents to, when they have to pick up a device, their phone or whatever it might be, to tell their kids, if the kids are nearby, what they're doing. So that's one thing that you could encourage to your patients. So part of this is parent setting, being a good role model, where you feel like you're going around the rules. Make sure you tell your child what's going on, right? So I have a deadline for, something for work this evening, so I have to kind of pick up my phone, or there's a family member who's sick. So, we're texting about that or whatever it might be. Next slide, please. So parent role modeling, a little bit more about that. There's more evidence that really supporting, again, like the critical role of parents in media behaviors. I will say that a lot of the parents in my clinic are already so overwhelmed with multiple jobs, or, children in different grade levels. So they're trying to keep up with all of those schedules, or just trying to figure out like how we can make sure to have enough food on the table this week, or, getting the car or transportation fixed, or trying to figure out how to get from one place to another. There's so many stressors on families' lives. So the point of this is not to make parents feel guilty if they can't do all of this, but really to hopefully help them feel empowered. There's this one study showing that parents with problematic media use were nearly 10 times as likely to have a child with problematic media use compared to parents without it. And another study showing that parental problematic internet use was associated with adolescent depression, even if the adolescent themselves did not have problematic internet usage. So I think the sort of positive spin, or like kind of flipping that around, that I see is that if a parent is able to make some changes to their internet use, if they realize that they're getting sucked into, scrolling or whatever it might be, their ability to cut some of that down helps their child as well. So they may not feel like they can be next to their child all the time, looking over the shoulder to see what they're doing on social media, but at least their own actions can kind of secondarily help their child in terms of being able to see how to manage their own internet use, and in terms of their mental health as well. And this is a great quote at the bottom from one of the youth advisory panel members, just putting a fine point on this, that parents themselves need to set boundaries and be role models and lead by example. And if you're trying to educate your child on safe social media, navigation, and screen time, then, parents should follow the recommendations that they set as well. Next slide, please. All right, so then intervention approaches on the next slide can be put into a few different buckets in terms of those that have some evidence base. Cognitive behavioral therapy, we'll talk about mindfulness, and limits. So on the next slide, many of you are probably familiar with CBT. The goal there is to first recognize and then change our unhealthy thought patterns and behaviors. So first, anticipating triggers, identifying the root causes of the behaviors, and planning a new behavior. What this could look like in this context is, what are the triggers of kind of picking up the phone and having that either excessive or risky internet use? Is it that you get bored? Is a trigger like a certain time of the day, it just kind of fall into a habit? Is a trigger that you have, FOMO, right? That I feel like you hear that a lot, where teenagers are like, but if I get home and I'm not immediately liking my friend's post or responding to things, then people are going to think that I'm not their friend anymore. Identifying the root causes. So there may be a more mental health, behavioral health related root cause. Maybe there's some anxiety at play there, and then planning a new behavior. So that behavior could be when I get home, my phone goes in a certain place and I do my homework first, or I spend time with a family member first, and consider that kind of like a decompressing from school before kind of picking up the phone to see who has posted or who's messaging. So the focus is not to say like you must now abstain from all technology, but rather how can we reshape their technology behavior? Next slide, please. And I should say CBT, there are many mental health professionals who are officially trained in CBT. There are some maybe like low-hanging fruit discussions that we can have if you're in primary care, for example, not necessarily trained in CBT, but a more in-depth discussion is probably best done with someone who is trained. Mindfulness, it can be a good tool in terms of that calming part of the 5 C's. So are they using technology to calm themselves if a youth is feeling anxious or sad? Is this kind of like the boost or the calming? So if so, then breathing exercises, meditation, again, there's some great apps, not to kind of like get people back on the phones, but at least maybe as a starting point of how to do breathing exercises or how to meditate, and then eventually they kind of put the phone away and do that on their own. It's really about kind of like self-calming, centering, getting a better sense of self-control. It might not get at the root causes, the issues may still be there, but at least in the moment, there may be some calming around the mindfulness. And then thirdly, on the next slide, um, what do we do about, recommending abstinence of technology or setting limits? Yes, you could remove technology. You can set strict limits that can definitely work well with younger children, who may not, they might not see the device as their own. It's really like the parents or another adult in the home. And so that adult can say, actually, I'm going to take my iPad back or my phone back. And that can be sustainable for a short term. But as kids get older, it's not really clear that can be sustainable. Enforcement becomes difficult. So there do have to be limits. Again, we know that there are some correlations between problematic internet use and mental, behavioral, physical health issues. But when it comes to strict limits for older teens, that does become difficult to enforce. The next slide, please. So in summary, problematic technology use or problematic media use or internet use is about the youth's relationship with technology and has a spectrum of behaviors and emotions and outcomes. Routine screening, as well as targeted screening is recommended. Maybe you start with targeted screening, certain visits or certain ages, and then kind of think about whether routine screening would work in your health center setting. And at least thinking about prevention is a good place to start. Again, looking at some of those conversation starters. The goal is to kind of like, arm parents with ways that they can have these conversations with their kids. Think about the 5 C's of media use. Again, if you're going to ask like one question in your visits, maybe that question is around, crowding out, right? So since we know that we increasingly are seeing concerns around sleep and your relationships with food and that sort of thing. And sometimes that starts with media use. So is the media use kind of crowding out other healthy behaviors? The family media plan is a great prevention tool and communication tool. And then, of course, parent role modeling. And those screening tools then are a good jumping off point to intervene or to provide some recommendations for solutions for families. And then other interventions, including CBT, mindfulness, and at some point, some kids do benefit from seeing a mental health professional. And then if you can kind of we'll click through the next few slides. I want to show you all a few of the resources that are on the AAP's website. So the URL there's at the top left, and we'll put it in the chat as well, aap.org/social media. So there are different categories on the site. There are upcoming programs that you'll see if you want to join more webinars. There's a Q&A portal, which I'll show you in a moment, some more tools and resources, multimedia resources, of course, the contact info. You can sign up for the newsletter and then more information. So on the next slide, just as an example of some of the tools there, You'll see the like sort of some one pagers there. You'll see the documents that have like the screening questions that I talk through, the strategies. So kind of like distilling down this talk for you as well. On the next slide is the Q&A portal, which is one of my favorite parts of this site. It's a two-way communication channel. So anyone, so a youth, a clinician, a teacher, a social worker, anyone can submit a question about social media and mental well-being. And there's a group of experts within the AAP Center of Excellence that review all of the questions and then respond directly to those questions. That response gets emailed back to the person who submitted it and is posted publicly on the portal. So as you're thinking of questions, someone may have already asked that question. You can search, a keyword, for example, for the question that you had. You may see that someone else has already asked it and it's been answered, or you can post a question yourself. You can search for questions based on age. Maybe you're like, I don't even know what questions people are asking when it comes to toddlers and media use. So you can search based on age. And then you can see there, the questions have been really far ranging from like school policies on digital devices, how to support children's behavior, or teens and body image concerns when it comes to social media. And on the next slide, just some more resources on the website. Each of these links goes to a one pager, I guess one page if you print on both sides, for each of the 5 Cs that based on age. So even for infants, right, we know that we have to talk about media use when it comes to infants. I know that I see it sometimes too. Talking to a parent and they have their baby and the baby's crying. So sometimes the parent will pull out the phone because something that's colorful and flashy catches the baby's attention and they stop crying for a bit. And the parents are doing that so they can have a conversation with me, right? So how might you approach those situations, right? How do you talk about, healthy media use in infancy? And maybe that's how do I tell parents that actually we don't recommend media use in infancy? How do you have that conversation in a way that is non-judgmental? So these one-pagers are great user guides for clinicians, and then there are similar handouts for parents as well. And on the next slide, the conversation starters, I mentioned that with the great questions and prompts. On the next slide, these are really cool suggested activities and printable activity cards. So things like, what about all those ads that pop up when your child's playing a video game or something like that? How do they figure out what to scam, right? What do you do when someone's trying to outreach to you? So these are some like interactive tools for families to use to have those conversations. And next slide. There's also a glossary of terms. So again, I'm somewhere between a Gen Xer and millennial. Sometimes I feel like I'm even older than that when I see some of these terms. I'm Googling them myself. So rather than kind of like randomly Googling, here's a whole glossary of digital media platforms. So what are all the different apps that kids are using these days? And then the terms as well are defined for you in one place. And next slide. So just another like image of what you can find out on the website. What are all these different platforms? Next slide. And again, just more resources on the website, more family tip sheets. Next slide. Some resources on the good and bad of social media. So some of these are youth-based as well. So these are great to print out for your teenagers or to recommend that they can even go to the site themselves on their own devices. And on the next slide, this is great for clinicians or if you teach trainees around motivational interviewing. There's some great videos on how you can do that in person with your families in a way that builds trust. Next slide. Some more talking points. So this is a good one to look for on the website. So what do you do when the parent is not concerned and the child is not concerned, but what you're hearing concerns you? So how might you start those conversations? So there's some great tips here. Or if the child is not concerned and the parent is, some like 2x2 talking points. And next slide, I think has some of the you can go for it. Well, yeah, so some studies related to some of this work as well, for those who want to dig deeper. And next slide. The five C's in a like kind of collected together into a nice resource hub. And next slide, please. For clinicians or administrators that are looking to start doing some screening, this toolkit walks you through how you can do that so you don't feel like you have to do it kind of without any guidance. And next slide. And then this is it. So a list of additional references and you can get pretty much all of these in the link that Renee is posting there in the chat to the ap.org website. And I believe that is the last slide. Yes. All right. Thank you all. We'll open up for Q&A.
Thank you so much, Dr. Falusi. That was a really informative and wonderful session. We would, like Dr. Falusi said, we'll now open up the webinar for a short Q&A session. You're welcome to raise your hands or put your questions in the Q&A section at the bottom of your screen. As a reminder, we will not be recording this, so feel free to ask any questions that you'd like.